Okay. Well, it's 2:31, so it's time to start. We are recording, so if anyone joins late, they will have access to the recording at the beginning of the meeting. All right. So, welcome. As I already stated, we are recording, so please avoid sharing protected health information. Use the chat if you have questions. We are managing the chat panel. To access the slides from today's presentation, you can click the link or go to the HICPUF TSAC page. If you are listening by phone, please be sure to press *6 if you want to unmute and *9 to raise your hand. Closed captioning is used by the CC icon at the bottom of your screen. And if you need accommodations, you can email hicpuff504ada@state.co.us. So what we do, the Department of Healthcare Policy and Financing administers the Health First Colorado program, or Colorado's Medicaid program, Child Health Plan Plus or CHIP Plus, and other healthcare programs for Coloradans who qualify. Our mission is to improve the healthcare quality, access, and outcomes for the people we serve while saving Coloradans money on healthcare and driving value for Colorado. So our agenda today, so we have some HCBS waivers and CFC presentations from our internal staff, Carly Altman. And then we have a presentation about a food resource from Mom's Mills, and Tina Gonzalez will be presenting that. To round things up, we have a couple of transition referral reminders, the links for you along with screenshots. And then we have our upcoming meeting schedule, and then the floor will be open for questions and open topics. All right, our first presentation will be the Home and Community-Based Services presented by Carly Altman. So I'll go ahead and be quiet. And Carly, I can drive for you, or if you want to present, just let me know.
Hi guys, good afternoon. Jay, would it be helpful if you can drive for me? I'll just click next slide. There are going to be some links that I am going to share with you guys in the chat to try and help navigate. And I think it'll be easier, Jay, if you click the link and it will maybe pop up the screen for you to switch over to that web page when we
Okay,
get to that section.
sounds good.
So thank you guys. Thanks for having me here. My name is Carly Altman. I work here at HICPUF in our Office of Community Living. I help oversee our training team that works really closely with our case management agencies to get them training on their roles and responsibilities as case managers, and information about all of the long-term services and supports that we oversee here in the Office of Community Living. I have a handful of slides for you today. I'm gonna keep them high level of the information that's on them. You'll have access to these slides later, but we can always go back to any of the slides that are shown if you have specific questions on them. I don't want to give you guys a bunch of information that you might already know, or that's not really the thing that you might be interested in. So we'll start off by just talking high level about some HCBS waiver information, requirements, eligibility, some community first choice information, and then I'm going to jump into those resources, okay? So our next slide just gives you a pretty good visual about federal requirements for HCBS waivers. We operate 9 waivers across the state of Colorado for adults and children's, and it is a requirement for us to operate those waivers in a cost-neutral way. We want to be providing services through those waivered programs that are intended to make sure people are avoiding institutionalization or reinstitutionalization, that they are always protecting the health and welfare and are person-centered in nature. So between all 9 of those waivered programs, and then also CFC, that's our end goal and some of the requirements we have from our federal partners. On our next slide, we have 3 main ways that folks can start thinking about how to access a waivered program or community first choice. And really, these are shown on the screen sort of in a 1, 2, 3 manner, but really they can be being done at the same time. So concurrently, we can be working to contact the local case management agency for where your area is served. And I'll give you a resource to find which case management agency that might be. And then looking to see which waiver is going to be, or a program is going to be most appropriate to meet that person's needs. And again, I have a really good resource for you that sort of shows them side by side comparison. So you can look at what services are we going to need? Where might this person fit in all of the requirements that are needed for each of the programs? And then also accessing the PEAK website. That is where members can look to apply for Medicaid and long-term care Medicaid in particular. And that is something that's managed by the local Department of Human Services agencies across the state. They are the ones who determine a portion of eligibility for these programs, while the case management agencies are determining another part. And that's what we'll talk about on our next slide with each of our programs that we're going to cover in this presentation. There is something called a level of care, and that level of care is intended to determine that this person that you're working with actually requires the same type of supports and services that would otherwise be provided in an institutional setting. So we have a hospital level of care, a nursing facility level of care, and an intermediate care level of care for individuals with intellectual and developmental disabilities. There are some subcategories that are more nuanced to some of our waivers, like inpatient psychiatric level of care, and that's geared towards one of our children's waivers. But these are our three main level of cares that the case management agency is doing an assessment with the member to determine where is this person fitting. And when we look at HCBS as a whole on our next slide, you'll see that there's multiple components to becoming eligible for these programs. HCBS eligibility, so that's those 9 waivers. Think in your mind, you've probably heard elderly, blind, disabled, the mental health supports waiver, the brain injury waiver. You might have heard of children's waivers as well, like our children with complex healthcare needs waiver. For those programs, a member's eligibility is dependent on multiple factors. They need to have a financial eligibility met. The financial criteria is established and managed by the Department of Human and Social Services in the county that that person resides. We'll look a little bit at some more financial detail in a few slides, but they also have to have Social Security Administration disability criteria met, unless they are over the age of 65, then they're in this elderly aged category. And then they have a level of care. That's where the case management agency is doing their assessment. And the case management agency is going to determine that level of care and something that we call targeting criteria. So it's very specific to which waiver somebody is looking to enroll into. But those first 2 criteria, the financial and the disability criteria, that goes through the county's Human Social Services Department. The targeting criteria for waivers, I'm going to give you an example on our next slide. This is an example of the developmental disabilities waiver, which you might have also heard about. Things like targeting criteria, that can include things like ages, how old somebody needs to be in order to access a waiver, or particular diagnosis that they might have, maybe particular injuries that they have. And in some cases, it could be based on the region. That's more geared towards specific services and a program for all-inclusive care of the elderly that we also offer. Otherwise, typically, we've got the availability for this across the state. It's true that when a case manager is doing this assessment and looking at targeting criteria, that somebody could qualify for multiple different waivers at the same time. They might be somebody who not only has a developmental disability, but also has a really significant physical injury. They might be elderly. They might also be blind. And so there are options for people in a lot of these cases, but it's important that they choose the waiver that's going to best meet their needs, based on the services that are offered through that waiver. And they can only be enrolled in one waiver at a time. Now, I want to caveat this with there's this thing called CFC, and we're going to chat a bit about that in a second. You can be enrolled in an HCBS waiver and Community First Choice at the same time. Those are not the same thing. And so you can have dual enrollment in that program and a singular waiver. All right, so a little high level on our next slide about financial enrollment process and income. So when we're looking at the income requirements and financial eligibility for members who are seeking out waiver enrollment, we're only looking at the income of the long-term care applicant when they're being evaluated for that long-term care eligibility on the financial side. For Community First Choice, that is different. We have different requirements for somebody to be considered eligible for Community First Choice if they're only going to access that program. For long-term care applicants who are under the age of 18, then their parents or guardians or other household income is also not included in that determination. So we're thinking about children with really complex medical needs there. In 2026, the monthly income limit for long-term care applicants has to be under what we call a 300% threshold of the SSI income limit, which this year was 2,982. That number changes on a regular basis, and so I'm going to show you a link to a website where you can get the most up-to-date information later. If somebody's income exceeds those thresholds when they're seeking out long-term care, there are other options usually for people to be looking at for their eligibility. That could be something like going through an income trust. It could also be accessing services through what we call the buy-in, which is where you pay a small fee to buy in to have Medicaid be your insurance provider of choice. So there are options. I always tell people don't take the income limits as hard limits. It's always best to apply and to go through the county to have that final determination made. We sometimes don't always know people's financial situation or how things might change or what can be counted or not. And we have really well-informed trained specialists at the county departments that are making those determinations. So that's always the best route for the financial components. All right, so you saw that I said CFC is different than this. So I'm going to talk a little bit about CFC eligibility. And our next slide, I don't know that we're going to watch this video, and there should have been embedded in this slide, so I apologize, Jay, but maybe we can put the link into the chat for them. There's a Community First Choice webpage, and there's a really nicely done introductory video to CFC that's an animated short video. And it's a good one to resource out to people to say, hey, if you want a little more information, watch this quick video, and they can start getting the idea of CFC. So that's a resource for you guys to use. But I'm going to talk to you about what would be talked about in that video. I just wanted to provide it here for you guys for future reference. When you come back and look at your deck, you can watch that video and take a look at the animated video there. But let's talk about CFC eligibility and how it is a little bit different than our HCBS waiver eligibility, because we talked about if you're looking for access to a waiver, the information that the county is going to look at for determining your financial eligibility is going to be based on you and you alone, not your home, your household of people. And there's a higher threshold. That's that 300% of the SSI. For community choice, a little different. And we can see that on our next slide. I'm going to give you a similar visual as our waiver slide, but you'll notice that there's a little bit of a difference there. Oh, there's the picture of what that video looks like. So when you go to the website, you're going to be looking for this video on there to play. And I would like you guys to listen to it on your own so you can actually pay attention and listen to the information there. But For financial eligibility and overall eligibility for Community First Choice, if you're looking to only access that program, then the criteria is a bit different. So the financial criteria still managed by the County Human Social Services Department. They're going to be doing all of that work. And their level of care that the case management agency does is still needed for Community First Choice. But you'll notice here, we're missing something like targeting criteria that we needed for waivers. So one of the big differences between CFC and HCBS waivers is that CFC doesn't have very nuanced targeting criteria. There aren't age restrictions. CFC is available to all ages, children all the way through adults. It's a particular set of services that are available, but we're not looking at things like ages and diagnostic information, injury information, but we are looking to make sure that they meet one of those level of cares that I talked about. And from a financials perspective, our next slide sort of lets you look at the different options of folks that might be looking to access CFC and a waiver together. Well, what criteria are we going to look at? We're going to see whether or not they are long-term care eligible. And I'll caveat this slide that it is a chart from 2024. I apologize to you for that as well, but there is the updated information on the link that's shared at the bottom of that slide where you get the most up-to-date information on income thresholds per year. So it's gone up a little bit from 2024 about what that asset is. And that first box you see on our screen here is what we talked about on the waiver slide. It's that, almost $3,000 per month of an income for an individual, $2,000 for assets. And then we're only looking at, we're going to look at the individual's income. Or you can be 65, elderly, or older, or have that disability determination from Social Security and Social Security Administration, or sometimes we hear people call that the ARG or Arbor because that's who we contract with. If somebody is looking for CFC only, though, we are not looking at the same income thresholds and financial eligibility thresholds. We are looking at the thresholds and requirements for somebody who would be looking to access Health First Colorado. So it's their modified adjusted gross income is what there's going to be looking at. And that means that it's the household income, and that can't exceed 133% of the federal poverty level. What that means is if you're somebody who's looking for Community First Choice only, you have to also be somebody who would financially qualify for Health First Colorado. So think about the members who are out there that do qualify for Health First Colorado as their insurance choice. They're typically in that lower income bracket within their household in order to be able to qualify. That's the financial threshold there for CFC only. When you add a waiver into the mix, that top line, that's when we all of a sudden get some additional options for financial eligibility because that threshold is raised up to the 300%. There's also an opportunity for buy-in, and I mentioned that earlier, that buy-in means you can pay a little bit each month in order to access Medicaid as the insurance of choice, and they have way higher thresholds for somebody who's in buy-in. Buy-in really means somebody's got a higher income, but they are still disabled, and so we want to be able to offer them access to these services through our waivers and through CFC. And so we're going to adjust what that income level looks like because they're also paying that premium on a monthly basis. All right, our next slide is another kind of quick visual for you as well about how does CFC fit into our overall picture. So when we think about Medicaid and what all of these options are, we see state plan Medicaid at the bottom. I like to think of it as a triangle. That's your Health First Colorado, that, doctor's visits, pharmacy, standard health care through Health First Colorado. After that, we have a second level of this community first choice, additional specialized services, but somebody needs to meet the level of care from the case management agency in order to be able to access those services. Even further up, we're thinking long-term services and supports, more of an umbrella. Think nursing facility. You guys are familiar with that level. And other specialized type settings. And then at the very top, we've got HCBS waivers. And if you click a few more times, Jay, it's going to come up with some additional information on the screen. There's some thank you. That's a little just second part of it. So you can see what we've changed recently, because CFC is new, is we took some of the services that used to be available only in those waivers where you had to meet really specific targeting criteria and that level of care, and we've moved them into this program called Community First Choice. There are different financial thresholds for Community First Choice, but there's also fewer restrictions on specific targeted population that those services can be available to. It is its own program. These are separate. Waivers and Community First Choice are separate programs, but oftentimes what we see is that they are accessed together. They complement each other really well. When you've got somebody who's in one of our waivers, it's likely that they're going to need access to the services that are offered in Community First Choice as well. And so your case management agency is going to assess for both of those programs at the same time and create service planning and service authorization for the services across both the waiver and the Community First Choice program. All right, and our next slide sort of breaks that down for you a little bit more. I think I must have updated the slides a little bit afterwards, but
I can
this
switch.
is just a, huh?
I can switch if you want me to.
Oh, no, that's okay. The slide I'm looking at just doesn't have that last paragraph on it, so I'm sorry that it's under the screen. This is just repeating what I was telling you, right? For somebody to be eligible for Community First Choice, they need to be enrolled in Health First Colorado. So that's that state plan Medicaid, base Medicaid, Health First Colorado eligibility. They have to meet that level of care and have an assessed need for the services that are offered. Or they could be in a waiver, right? We talked about that. They could be in a waiver, getting at least one waiver service per month, and also have that assessed need for CFC. But oftentimes we are going to see that people are concurrently enrolled in both a waiver and Community First Choice. Our next slide is some timelines, and these timelines are applicable in a general sense to all of the programs under LTSS. A case management agency, when they are receiving referrals to access these services from multiple different sources, they have particular timelines they have to follow in order to complete their level of care assessment. If they're getting a referral from a hospital, they've got to go and complete that assessment in 2 days. If they're getting a referral from a nursing facility, 5 days. If it's from somebody who is residing currently in the community, 10 days. And those 2, 5, 10 days, there's some variability of things that can happen that might delay that process a little bit further, like getting in touch with a member, scheduling conflicts that are out of the control of the case management agency, and other documentation that's required during that referral. So keep that in mind. But once they do get that information and get their assessment done, they'll be creating their level of care certification saying this person meets that level of care and getting that information over to that county Department of Human and Social Services. The county actually has 45 days to process financial eligibility determination once they get that level of care. Sometimes that goes a lot faster depending on what that person already has established with regards to their eligibility for Medicaid. Sometimes it doesn't. If somebody's really starting from scratch, no eligibility determination at any level on the financial side. And then they actually have an additional 45 days if somebody requires that ARG Arbor disability determination, which is not required for CFC only, but is required for waivers. So this process could take a long time, right? Waivers and community first choice are not emergency type services. There's not an intention that they'll be able to access them urgently. We do still have to work within the timelines that we have. It can be a little bit of a process to get somebody up and going and getting into these services initially. I know you guys help with um, a lot process for a lot of this population and moving things along. I just always like to remind people that it's not going to be a same day or a next day process. Usually there's going to take some time to get level of cares done, service planning done, PARs, and service authorization after eligibility is done. So our next slide is the resource that I wanted to really kind of hone in and share with you guys. It's available on our long-term services and supports training page. Jay, if you feel comfortable to be able to click that link and navigate, I will direct you where to navigate, and you guys can all watch so you can find this form yourself too. And I don't know if it'll make you
I switched
reach.
screens. Did it?
Yeah,
Okay, there we
perfect.
go. Okay.
Yeah. So, okay, this website, Long-Term Services and Supports Training, I highly recommend you bookmark this page when you get the link. It's going to be full of information for you that is hopefully the most up-to-date information, and you can go here to find detailed information about a lot of different things with our programs. So on the one side of the page here, you see waiver charts and flow charts. So HCBS waiver charts. Jay, if you can click the one that says adult waiver CFC PACE chart July 2025. Yep, that one. There's the exact same thing, but it's for children as well. But this document is actually the probably easiest to read and provide out to members when you're talking with them or other professionals even too. To see a side-by-side comparison about these different programs and like, man, how do I choose which program is going to be best? Which path I should go down for my members. So a lot of introductory information about the programs in general. What are waivers? What is CFC? And then when you scroll down, you see this nice chart here, and it will tell you what is the primary purpose of the waiver program. So we've got BI, CMHS, CIH, DD, EBD, SLS, and then community first choice there in those bold lines and PACE. And so you get a nice brief description of each one of those programs. What age is appropriate for those programs? You'll notice these on the adult waiver chart all say age 18 and older, except for one. It's the brain injury waiver. And we actually let folks that are 16 and older go into that program. And then when you keep scrolling down, you'll see information that lets you know who are we trying to serve with this waiver. So what population of people are going to be most appropriate for each one of these programs. And then the most important part is that list of services underneath each waiver. It's going to tell you what types of services you could expect to access if you do get determined eligible for the waiver. So if you scroll up a little bit before we get to the check boxes, there's just on page 6, a little bit higher, these lists, right? So they actually start on page 5 and go to page 6, but you can see, hey, under the brain injury waiver, I can potentially access adult day services, assistive technology, behavioral education, day treatment, home mods, gives you that whole list. And you can sort of follow across the line to say, you know what, looks like adult day services are offered in all 5 of these waivers. Wonderful. Okay, well, what I'm really looking for is access to personal care. And I want to do that access to personal care. Where do I have to go for that? That's going to be listed under community first choice. That's an indication, hey, I need to be seeking out community first choice. If you want day program also, then it looks like we're going to be looking for a dual enrollment, a waiver, and CFC at the same time in order to access those services. So I love this chart. It's a really nice desk side reference. And if you go down even further, Jay, where you were, there's references to regulatory guidelines. So if you're a regulations person like I am, I want to go read that nuanced detail about what is included in this service, what is not included in this service, all of that information about each individual program. You have citations here, so you can go look those up if you want to. And then there's also some landing pages of links of information. Even further down is like a checkbox chart. So you can just scroll and say, I'm looking for an alternative care facility. Maybe instead of the nursing facility, where am I going to be able to access that? Okay, looks like I could maybe do that through the CMHS waiver or the EBD waiver. And then we want to look at what other types of things that person might need. So this resource really great. I hope you guys take this and bookmark it. But if you go back to that landing page of the LTSS training, um, I'll let you know that it's not just these waiver charts that are on here. You also can have links to each individual waiver. Um, you can look even further down at a bunch of different training that's available publicly. Like anybody can access this web page, but if you're like, I want to know more about this thing I keep hearing about, age-appropriate guidelines, what in the world is that? It's something that case managers use to help determine assessment and service authorization. You could watch the training that was provided out to them. Some of these trainings are webinar recordings. Some of the trainings are e-learning modules where you can do some self-paced learning to work yourself through that content. It's not just a recording of somebody's presentation. So another great resource for all types of information you want to dive deeper into. If we want to pop back over to the presentation, the last couple of slides are really just additional resource slides for you guys with some specific links that you can bookmark as well. So if you're thinking, I don't know and can't remember which case management agency serves which area, who I should be working with, finding your case management agency is pretty easy. We have a website that is interactive and it's a map and it helps you search which county you're in and which agency serves that. There's also a list of county eligibility, so how to get in contact with the county department too. If you're thinking, I don't know, somebody might be living right on the line, right? Are they in Arapahoe? Are they in Adams? You can look at that website, help you get contact information there. The next slide is, again, some links to our rules because I couldn't help myself but put some rules information in here. 8.7 thousand on our Secretary of State's website is where all of those case management services and waivers rule lives, and CFC. And then 8.100 is where financial eligibility for Medicaid lives. So if you want those nuanced pieces of information, you can go to the Secretary of State's website and read through those two sections of rules and get a lot of information. There is another web page called LTSS, Learn About LTSS, and this web page is one that I would suggest you can direct members, families, and other professionals to. There are a lot of videos on this Learn About LTSS website. They are animated videos, kind of like the CFC one that I referenced earlier. And they give high-level overviews, like what is a waiver? What do I need to do about this? What is my case management agency responsible for? And there's also some additional list of links on that webpage to tell you, hey, do you want to know more about the EBD waiver? Click here and it will take you to that landing page. So that's also another really beneficial website to go to. And I want to do a time check before I would say go to that website, Jay, but if we have time, we can. The only other slide that I have really is another page about rights, members' rights, and there's some really good informational videos about what are my rights as a member who's enrolled in an HCBS waiver and those responsibilities. And those are also animated videos that were designed to be shared out with members and their families to give them some information about what they can expect and how they can expect to have their services provided to them once they are enrolled in these services.
Yeah, and I think we have time. I can pop there really quick if you want me to.
Sure, yeah.
Okay, let's see. I think this is the page. Um, this is the one the link took me to. Does this one look right?
Yeah, it's
Okay.
learn about long-term services and supports. All right, so at the top here, there's a couple buttons on the top that will jump you to different parts in the page, but you can look at informational videos, program enrollment, the adult waivers, children's waivers, CFC, participant-directed programs like CDOS and IHSS, and other programs. We also have a really comprehensive enrollment guide on this page that does a nice job of visually representing and walking somebody through what the eligibility process journey looks like. And trust me, it is a journey. So if you scroll down, it's going to give you some high level information. Again, this is really meant for public consumption, but we've got this whole list of videos there. Some of them were made by our partners at the Colorado Disability Coalition. They actually were working with real people and doing some interview and informational stuff and getting that put together. They have sign language interpretation on those videos. The other row of videos are just the animated short videos, so they don't have real people in them. But both, I think, are really helpful. Just depends on what kind of style you like to get your information in. And if you're not a video person, and these topics of videos aren't what you want to know about or what your member wants to know about, then there's written information later down on the page. You can go to the HICPUF landing pages for each of the individual waivers, and some of them also have some brochures that we have created. There are a handful of others that are under review and additional development for updates. So this page is a living page and will grow with additional time. But you can definitely click any of those links to learn more about the programs. And then we have a list of all of these extra programs too. This enrollment guide, you can see the carousel there kind of taking you through a couple of the pages. That's what it looks like, but you can always click and download. There's an English and a Spanish version. And it really does kind of step by step walk a member through, hey, if you're going to be seeking out these services of HCBS waivers, long-term care, there's some steps you have to follow and things that you can expect to have to go through or information you can expect to provide. This guide was created in 2024, so we have had some changes since 2024, particularly with CFC. But what I would ask for you to take away from that guide is that, and primarily the information in there is the same and the process is the same as it was just for HCBS. We're just looking at a different program at the end of the day that we call CFC. There's some nuances on the financial eligibility, but I really still do love this guide. And at the bottom within the guide, it's a long document, but there's like a checklist. So that makes it pretty easy too. A great resource for you guys to use. And then at the bottom, you can also see links to where you would find, again, your case management, like how do I find my case management agency? And maybe what do I need to do if I've got questions, I need help. We have a HICPUF HCBS questions inbox. You could also contact Ombudsman, depending on what the situation is, or the member contact center. So a couple links there for extra information. All right. I think that was probably my last slide. I know that's a ton of information. Yeah, this is the member rights, member resources videos that were created, also created in 2022. I know that's a couple of years ago, but these are great videos also, and they do an excellent job of explaining to individuals what their rights are when they're in these settings and into the community and receiving these services.
Okay. Great. Thank you, Carly. A lot of good information. We appreciate it. A lot of resources that I'm definitely going to hang on to and share with the transition coordination agencies. I'm sure a few of them are on the call as well, but a lot of great information. So thank you so much for sharing. I,
Absolutely.
I
I
think we
don't
have
know if
a
there were any
couple.
questions in the chat. Let me.
There's two. So there's one that says, do the state hospitals, Fort Logan and Pueblo, fall under the hospital category for CMA timelines?
Yeah, they do. If you're getting a case management agency is getting a referral from somebody who's at Fort Logan or Pueblo, then yeah, that would be under the same timelines. I think there's some maybe additional coordination that might need to happen when you're looking at somebody who's trying to discharge Fort Logan or Pueblo. And there's probably additional planning and timelines and dates and things that are being looked at from that hospital's perspective for their transition into the community and out of that setting that might are definitely not at the same level that we would see somebody maybe needing to discharge UC Health back home, or UC Health back, into a nursing home, perhaps before they're going into the community. So yeah, that does count, though, Kelly. That's a great question.
Yeah, great question, Kelly. Thank you. And then there's another one that says, any update on the nurse assessor role and input?
Yeah, that's an interesting question, Pat. So the nurse assessor program, as an entirety, as it was rolled out several months ago, has actually been discontinued. That discontinuation was official, I want to say in like mid-December. I don't have the exact date for you, but we did stop that program. So there was a short period of time where we were utilizing our nurse assessors to do work with our members to determine service authorization for skilled care services like health maintenance activities, long-term home health, CNA, private duty nursing, like all of our skilled services. And with the discontinuation of that, what we've actually transitioned to is having the case management agency fully utilize a document called the Direct Care Service Calculator. And that Direct Care Service Calculator allows the case manager to go through specific tasks and make a determination if their services should be authorized under health maintenance activity as a skilled care need or under personal care or homemaker, which are non-skilled. And then how many hours per task that they can actually authorize for that member. There are some dependencies in there during their authorization, and there's some instruction to tell them how to determine is something skilled, is something not skilled. And they will be the ones who are authorizing health maintenance activity services. Those are the skilled care services. Case managers do not authorize long-term home health or private duty nursing. That is not done through the case management agency.
Thank you for that, Carly. And Pat, I also pulled up the operational memo that went out about the ending of the nurse assessor program. I pulled it up on the screen and I can also email it to you if you would like. It has a little bit more information as well about that program.
Yeah. And for access to that calculator, Pat, yes, that is totally on our website, public. It is located on our long-term services and supports program page under our case management tools page. So I'm going to send you the case management tools page website. You guys can bookmark this one too. It's a really good one. You can access it through the page that I told you about before, the training page. But if you want another quick, easy bookmark, it's this one. This is where a lot of the forms and tools that case managers use in their daily work are located. Some of these are offline forms, meaning we actually have them in our care and case management system, but in case that system goes down, we have offline versions of it. Other forms and resources are just housed here and intended to be utilized as resources. So for the direct care service calculator, you're going to scroll down to program and waiver specific resources, and it's going to be listed under CFC Direct Care Service Calculator Adults. And that is applicable for any adult who's wishing to access personal care, homemaker, or health maintenance activities that need to be authorized by the case management agency.
Yes, thank you, Carly. Lots of good resources and information. And Pat also left another comment about wanting to use the tool to find out what's going on with some of the senior living apartments and locations. So, and Tom, it looks like dropped some resources with the updated calculators for CFC for children and adults. So,
Yeah,
mm,
thanks, Tom. And Pat, I will just throw it out there like this tool is available for anyone, but not anyone can fill it out, right? It's the case manager's responsibility to fill this document out, and they are the ultimate responsible party for service authorization. So it could be good to be looking at and understanding what's getting looked at, but it is a case management agency form. Um, and yeah, I hope that you can get some more insight into what's happening in that senior building for sure.
yeah.
Any other questions? I know that was a lot and it was very high level overview, and you guys might have like way more specific questions you want to ask. I can try and answer anything, or you're welcome to escalate additional questions after the fact to your lovely team here, and they will get in touch with me to get you answers.
Yes, you can email me or anyone else that's on the team that puts this together. You can just email me since I'm hosting this month, and I will get the question to Carly. No problem at all. And I'll drop my email in the chat as well if you all need it. If any questions come up, I know there was a lot of information, but a lot of good resources, Carly. So thank you so much for coming. I know I appreciate it. We'll be using some of those resources myself as I'm assisting TCAs. So thank you.
Absolutely. Thanks, everyone. Thanks for having me.
Yep, thanks for coming. And I don't see any questions or any hands up or anything else in the chat. So you're all
I'll stick
good. Thank you
around
so
for a
much.
few more minutes in case something comes in.
Okay, sounds good. Thank you so much. All right. So our next presenter is going to be Tina Gonzalez, and she's going to offer us some information about a food resource. So today's meeting is jam-packed full of good resources for you all. So Tina, if you are on the line, I will kick it off to you, and I'll go ahead and drive. So just let me know when we need
Oh,
to go to the next slide.
that is perfect. And it's a perfect leeway from Carly's presentation because this is one of the programs that was kind of carved out and developed under the CFC waiver. But and I have my presentation up, so I'm not going to be on camera because I won't be able to see you guys. So I will be a talking voice through the machine.
Sounds good. No
So if you want
worries.
to pull it up. So, a little bit about Mom's Meals. If you want to go to the next slide, and like I said earlier, this is one of the new programs under the CFC, Community First Choice Waiver for members in Colorado. And so, even though Mom's Meals has been working with Colorado for several years, this kind of allowed us to expand some of our services and to reach more individuals with home delivered meals. So we do have different relationships, one with all of the CMAs, so we get referrals from them for their members. We also work with some of our AAAs, our PACE programs, and then a little bit later on, I do go into if individuals have support from family and don't qualify for any of the home delivered resources, we do have a self-pay model as well. And so CFC kind of I think Carly did an amazing job at kind of looking at resources and what the CFCL encompasses, but really kind of ties in with that home delivered meal and keeping folks in their home and in the community and active in their community. Just one way that we have to support. So if you want to go to the next slide, um, with the transition, this started July 1st of 2025. So it was one of the programs that was tucked under the CFC. And like Carly shared, you can have your HCBS waiver plus CFC resources or services. Not that you have to access all of them, but we have seen a steady incline of the home delivered meal referrals coming in, which is awesome. And a lot of folks, any age, and we'll kind of go into that a little bit later, we kind of service here in the state of Colorado as well as nationwide. And so with the CFC and with the 1115 waiver kind of coming down, going live 2027, some of the feasibility studies that Colorado has done, and I'm sure everyone has kind of seen those, is that they're predicting or anticipating a little over 53,000 members in Colorado actually being eligible for home delivered meals. So that's 53,000 people who would have access to meals and to that are tailored towards their dietary needs. And so that's really, really exciting for Colorado. So on the next slide, it kind of goes over why it matters. Really, the main goal is keeping people in their home, kind of increasing what access to services they have for long-term care services. Fortunately, knock on wood, home delivered meals is one that has not been impacted by some of the federal legislation. And so it's not going anywhere in 2026, which, like I said, is amazing. There's also no break-in services. So if an individual that we are currently working with has like an EBD waiver, and will be, once they get their annual kind of services, kind of see what else they might qualify for or what else that they are requiring. If they do decide to get CFC as well, there would not be that break. We would just continue and just kind of switch over from EBD over to CFC so that there isn't any lapse in services or that members aren't going without food for any amount of time. And the increase for the demand for home delivered meals, we continue to meet the need and continuing needs of our members. So on the next slide, and it kind of shows a picture of one of our meals, the increase to accessibility and eligibility, which is amazing. Before, like I said, home delivered meals was always in Colorado. It was just a lot stricter on who qualified. And so with CFC, it kind of lessened some of those criteria and allowed more people to be eligible. Along the way, you're going to see some references on the bottom, and I think these slides are going to be shared with you because there's also going to be some QR codes that you can actually look into to dig a little bit deeper into certain topics, or if you want to actually see some data and some successes from the home delivered meals. So more people now qualify for services. So every year we do surveys with all of our members nationwide, just to improve our services, keep the services that are working, and kind of look at some that are struggling. So we do take our member voice very, very seriously and kind of how we provide services to them. On the next slide, so meals under CFC, this can be customized to fit the needs of the member being referred, and that's an internal. So we do, the way Colorado now has it is that most of the referrals that we're seeing is for 2 meals a day, with a maximum of 14 meals per week. And so we have a menu of over 60 plus meals that folks can choose from, depending on what their dietary and their chronic healthcare conditions are. And so we also include meals that are pureed, are liquid, or are softened for any medically necessary types as well. And so on the next slide, we really kind of look at the different populations that we do work with. And a lot of the times, folks internally have an assessment tool that they utilize to see who qualifies for what. And so these are some of the common questions that we do see on all aspects of whether they're working with a AAA, a CMA, or a PACE program to be qualified or eligible for home delivered meals. And while screening, if they answered yes to any of these questions, more than likely that member it does qualify for home delivered meals. And so when we kind of surveyed some of our providers and some of our members, 76% of them say that the home delivered meals is the most important service, allowing them to stay in their homes. And so the more individuals that kind of screen in, the more individuals we can kind of support to keep in the community and into their homes. And so it's a little bit of background on kind of what is anchoring us now in Colorado and kind of some of the goals that we have in broadening and expanding some of our partnerships with healthcare providers and with members themselves. So on the next slide, I just want to share with you a little bit about Mom's Meals, if folks aren't familiar. So Mom's Meals started back in 1999. It was started by the Anderson family in a small rural Iowa town. Barb Anderson, who is the mom of Mom's Meals, so yes, there is a mom. She actually started cooking in her kitchen when her mother and her mother-in-law lost their spouses. And so both of them had chronic healthcare issues. And at the time, there really wasn't a lot of resources for her to go to actually get someone to do the medically tailored and to help get delivered to the home. And so she started doing that for her mom and her mother-in-law. So when other individuals started realizing what she was doing, they started reaching out saying, hey, can you also do that for our loved ones? And so the fact that there was a lot of individuals who were widowed, living alone, needing that nutritious meal, that kind of drove the mission and developed into Mom's Meals. And so her first contract was actually in Iowa, providing meals to older adults living in rural and remote areas, um, or for existing meal routes or senior centers offering congregate meals. And so she kind of partnered with two different entities. So essentially, it was kind of born out of the passion of helping people, which we have maintained for years. And so that actually guides not only our mission, but kind of rolls into our guiding principles. And so in the middle, this is Barb Anderson and her mom. So it was really their close relationship that kind of launched Mom's Meals into what it is today. And so on the next slide, as you can see, it started in Iowa. She is now nationwide. So founded in 1999 in Ankeny, Iowa. That's still where our home office is today. We've delivered over 70 plus million meals each year. 600,000 to individuals served last year, which was 2024. So this was, I have to get an updated slide for 2025. 69 locations delivered nationwide to any address, no matter how remote. And so that's one of the benefits and a lot of attraction that we get from agencies is that since we have either our own Mom's Meal drivers or third-party delivery, we can get to any address anywhere in the state, in the nation, actually. And so we do get a lot of those referrals, especially from some of the senior centers who have Meals on Wheels, but they can't get to a certain location. They will contract with us so that we can kind of make sure that that individual is receiving meals. On October 7th of 2025, the company kind of hit its first milestone of 1.5 million meals delivered that week. And so we continue to kind of hit that mark. So from a small town, started in the home, she's now kind of nationwide. On the map, the little circles are the distribution centers, and then the ones with the stars are our kitchens. So we, with the CFC waiver and with some of the 1115 waivers, we have expanded into other states. And so we just added a distribution facility in Albuquerque, New Mexico. So that's kind of something new. And as we continue to grow, really hoping to see one here in Colorado. So on the next slide, it kind of goes over all of our program offerings. So of course, the medically tailored home delivered meals is our number one, but we also have programs with produce and pantry boxes. We have nutritional counseling and education. We have that oral supplement. So we do have the pureed meals, are meals that are geared towards individuals who have either a chronic healthcare condition where chewing or swallowing is impacted. And then we also have shelf-stable meals. The shelf-stable meals we kind of utilize a lot. So if they are getting like home delivered meals, and like this past 2 weeks ago when we got that snowstorm, a lot of individuals kind of saw that coming, ordered the shelf-stable meals just in case the home delivered meals weren't able to get to the member, or if there's a crisis or a fire, a drought out in Florida. We see it a lot for hurricane season, just to make sure that individuals have food in the home until we can get them back onto the medically tailored meals that they were originally on. So lots of programs to keep people in the home and medically tailored shelf-stable nutrition to make sure that they also have food in the home. Our programs are geared at all ages. So improving life on the next slide, I'll kind of go over. So it's designed for all ages, kind of bringing that comfort and that stability of keeping folks in the home and independently. So really, depending on what population type that you guys work with, or if you see folks that are working with either post-discharge from a hospital, if they're pregnant, and needing that, if they're diabetic or newly diagnosed diabetes, we have programs for that. And then again, we have that private pay and for caregivers. So we do see a lot, especially with the AAA If we have a spouse who is getting mom's meals and the other spouse doesn't qualify for the older American dollars or other home delivered meals, they'll just purchase on their own. So they become a member so that they're getting it delivered from one location and they're not having to worry about either getting to a grocery store or the transportation to get to a grocery store or to a food bank. So again, expanding across. And on the next slide, it kind of goes over our program itself. So our meals are refrigerated. They are not frozen. They will come to the member's home cool and ready to be placed into the refrigerator. So we support most of the major chronic healthcare conditions. So we have a meal, and I have it on the next slide, kind of how you choose your meal and what menu is more appropriate for members. Choice of every meal, every delivery. And so they will get a monthly shipment of meals. They are able to choose what meals that they want. So it's not customized for them and it's not preset. And so if they have a favorite, or if you're working with someone who's not very picky and they're like, well, just send me one of everything. Usually it takes about 3 weeks for them to exhaust our entire menu and then they can start choosing what their favorites are. We can deliver to any address. And then our customer service will actually initiate that phone call each week to get the members menu items and then make sure that it's en route. We have the correct address. Nothing's changed with the member, so that really build that rapport with the individuals. Our customer service are Mom's Meals employees. And so we don't have that 3-minute rule, like your calls have to be answered. I mean, your calls have to be over within 3 minutes. So a lot of them actually have built rapport and kind of those friendships with some of our members, especially folks who live alone or folks who really don't have a lot of contact. They get to kind of know us a little bit better. And so when the meals do come, on the next slide is actually showing you kind of what the temperature control is. When a member orders a meal, we have an entire logistics team that actually tracks weather patterns, traffic on the highway, to make sure that when the meals get delivered to the member's home, that they are still cool to the touch, and that member was actually able to get the meals. And so we do have a way internally to track. On the picture on the left-hand side, what you're seeing on top are actually the gel packs, depending on how the weather patterns are. So the hotter the area, like in Arizona, the more gel packs. The cooler the weather, like in Alaska or some of the other states, there'll be less of the gel packs. The gel packs are only inserted into our meal boxes, our sample coolers, and our meal coolers for folks who are getting third-party delivery. In the event that they are working with us and we actually have a Mom's Meal driver in the area, they will actually get delivered in one of our, in a while I'll show you what our trucks look like. And there's no gel because they will not leave a meal at the door if someone isn't there or if they have not had contact with the member if they are not home. If they are not home, they automatically have a cheat sheet to tell them how many gel packs to put with the box so that the meals are still cool to the touch when they're able to, members able to come home and get them into the refrigerator. On the far right-hand side, this actually looks, when you open the box, this is what it kind of looks like. So they're not only getting the meals that go into the refrigerator and are microwavable or oven safe, but they're also getting the sides, plus their snacks. So if it comes with the juice, if it comes with a fruit, a piece of bread, our granola bar, all of that's included in the price and in the cooler and for the program under CFC. And then on the next slide, everyone always asks like, well, what does it look like when they put them into the refrigerator, especially if they have other individuals living in the home? On the far left-hand side, it actually kind of shows you. And kudos to anyone whose refrigerator looks like this. This is not what my refrigerator looks like, I assure you, but it kind of gives you that visual that they are stackable. And there is more than enough room for other food items in there if they do have folks that live with them or if they have other items that they need to kind of keep cool in their refrigerator, or if they have a small refrigerator, just kind of how you can make everything kind of fit. And so again, 72% of our members who work with us prefer refrigerated meals over their frozen meals that they have tried. And so it's really easy access, and they're able to go and choose what they want to eat for that day and not have to pull it out of the freezer, defrost it, and then kind of be stuck having to eat what they chose. And then we do follow all USD office policy and criteria. We actually have a USDA office that shares office space in our Iowa kitchen. So we're always making sure that we're in compliance with all state and federal. In the event that we are working with you and you have a member and they're like, hey, I saw this on your website. How come that meal's not available on our menu? Chances are is they're looking at a different state's menu, and we do have to go by what the state criteria for the dietary needs depending on what chronic healthcare condition. So that's not coming from us, that's coming from either the state or the federal mandates. If they do want to order that meal and it does fit with their dietary needs, they can, it would just be self-pay, but we have to follow the menus that Colorado has kind of put forward. So on the next slide, this one's really exactly what I was saying, just that we follow anything that we see. We'll make sure that we're in compliance. Even if we hear about something that's coming down the pike, we'll kind of look at our menu options and remove any ingredients. The most recent one was the red dye that we were using. Once we saw that that was coming down, even before it became federal mandate, we were able to update most of our meals. Since we own all of our kitchens and all of the chefs and our nutritionists, we're able to do that pretty quickly. Kind of turn that around. On the next one, this is the one I was referencing. Oops. Did you miss one? Can you go down a little bit?
So
It
go
should have
down.
one that says pick the right medically tailored menu for your client. Do you have that one?
There
There
it
it
is.
is. So on this one, when you're working with a member, if a member is looking at our menu options, on the menu itself, on the right-hand side, it kind of gives you a visual of what our menu kind of looks like. There are symbols. So if they're looking for the diet-friendly menu items, they can actually look on this menu and actually see once it has that like little teardrop with a plus or minus, that tells you that it's a diabetic-friendly meal. If you are working with a member, and because we have to meet the dietary guidelines for the state, if there's question on the menu or if they're not too sure, or what I have seen lately is that an individual's had a gluten allergy as well. And when we kind of looked at their granular level, it was really the sides. Some of the diabetic meals came with a granola bar. We just let them know our nutritionist worked with the individual on how to pick the menu options, let her know that it's still going to come. You can either throw it away or donate it to someone. But everything else in the meal was diabetic friendly. And so if there's any like those granular questions, our nutritionists are always available to kind of get on and do a consultation either with you or the member or both folks on there. On the next one, it kind of gives a couple of more pictures of what our meals actually look like. So once you heat them and serve them, and again, that choice of every meal, every delivery. And so, of course, 92% of our clients say that that's one of their kind of highlights of working with Mom's Meals is that they're able to choose their own meals. And from a menu that is ever changing. So every year we will change menu items. Our top sellers stay, our lowest sellers, our lowest 5, they'll actually remove from the menu, but then they'll add 5 or 6 new ones. And so it's always ever changing for them. On the next one, this is, like I was mentioning, on the right-hand side is what our Mom's Meal trucks look like. So we did take a Dodge Ram and we revamped it to kind of do the refrigeration on one side and the freezers on the other side. The freezers are for the gel packs for when they're delivering. My goal is to have Mom's Meal delivery drivers in the state of Colorado. New Mexico and Colorado were two of the states that were kind of expanding. We just hired our first driver in New Mexico. So really excited to see that. But right now we are working with UPS and FedEx, the third party, which allows us to kind of get to any address anywhere in the US. And so of course 91% are very satisfied with our delivery. A lot of it, and what we don't have control is with the third party, is that they do start to bond and make a relationship with folks who are delivering their meals as well. So that's another benefit of actually getting mom's meal drivers out in the community. On the other one, it just really kind of highlight on the next slide, our compassionate customer care. Like I said earlier, they are our employees. And so if they're tracking issues or if there's a concern and they need to escalate, it goes directly to me if I'm working with that state. And then we pull in a care manager, care coordinator, case manager, whoever's working with the member. And of course, we last year got a 95% customer service satisfaction. And so we do have bilingual. And we did on our website and our ability to communicate with over 160 languages, we just added 7 more languages. So we continue to increase the populations that we can work with and kind of really support some of that culture and some of the identities that our members are identifying with. So all of that in a nutshell. And I forgot to ask you how much time, so I'm going a little bit fast, but there'll be time for questions. On the next slide, it does go over our referral process options. And so we do have relationships, like I said, with all of the case management agencies, so they know how to refer to us. It's literally a single form. We are also on Wayfinder, so if you have folks who are looking for services, either for themselves or their family members or their loved ones, they can kind of do their referral for themselves on Wayfinder. We do have a Mom's Mill portal. A lot of our AAAs utilize that, where you can kind of go in and submit the referral that way. We do have some of our agencies in Arizona who still use fax machines. So we do have the ability to upload a file via fax. So different ways to do a referral. We do have two different referral processes in Colorado, though. So if you have someone who's on a CFC waiver or on a waiver type, versus someone who's being discharged from the hospital and they have that prescription for the 60-day, I believe it's 60 days of medically tailored meals that we do also support in the state of Colorado. So and the end, I'll have my contact information. So if anyone wants a referral. And on the next slide, it's just a quick overview of the program. Enrollment. As soon as you refer someone to us, they get a welcome call from our customer service. Customer service tells them, hey, this is our program, and then they initiate the first order with them. When their first meal is delivered to them, inside there is actually our menu, so that they can start looking at it and start figuring out what they want to do for the next week. And then they eat and enjoy. And then the ongoing supports from both myself and our support team. And we also have for individuals who maybe not like talking on the phone or maybe don't have access to a phone all the time or have a personal care assistant in there who's helping them. There's also a way on the next slide to actually order online. Or if a member is working with a family member who's not in the state and they want to make sure that they're ordering and that their meals are on their way. On the next slide, it has the web address. Or if they are wanting to see what our meals look like and they have the order form, the menu in their box, they can also go onto the website, look up the meal, and it'll actually show you what it looks like. So if they're more visual and kind of want to see what it's like, I don't know if you have friends who like to take pictures of their lunch. I have never gotten that, but if they like to see what the meal is going to look like, this is actually the pictures of our meals once they're heated and plated. And it has all the dietary markers on there as well. On the next slide, as part of our campaign and our education to communities, we always get the question, well, what do your meals taste like? What's the texture? What's the flavor? For any folks who are on this call, Jay and I can put the link in the chat. If you would like to sample some of our meals, if you guys work with a member or work with an organization who might refer individuals for home delivered meals, I will actually put a link in there that you can actually use to get a sample cooler. What this does is it allows you to experience the full life cycle of what a member will go through when working with us. So you actually get to see the menu, choose your 3 options, and then it will get mailed to your home. You can kind of see the packaging, what the cooler looks like, kind of what the gel packs look like, put it in your refrigerator and actually heat, and then kind of taste what our meals taste like. I love doing this because there's a couple of different home delivered meal providers in Colorado, and I believe we're one of 7. Depending on your member's lifestyle or what their kind of their palette of taste is, will kind of impact kind of, hey, our goal is to keep people in the home. But if you have access to the best nutritionists in the state of Colorado, the education, the support, if they get meals and they don't like them and they're not eating them, then you're kind of back at square one, even though you have all these support. So we want to make sure that it's something that they're going to enjoy and that they're going to taste. So when you're working with them and they're asking you for your perspective or for any recommendations, you can actually say firsthand account, well, I tried them. This was my experience with it. And so that's one of our educational things that we kind of like to do with communities. So I can either send that to you, Jay, or put it into the chat. It's a link. You just click on it and it'll kind of take you straight to our site to order.
Okay, you can do both. That works too. And
Okay.
then that way we can put it somewhere on the presentation. So when people download it, they have access that way as well.
Perfect. And then on the next slide, we actually have a dedicated website for the state of Colorado. So up type is the link, or if you have a phone and want to use a QR code, this one will actually take them to the website. And again, it'll kind of show the meals. But what they can also do is if you have folks who do not qualify for the home delivered meals, or if they have a spouse who like, hey, I like these too, can I order them? It actually has a way on our website, and it kind of shows you the pricing of the meals for self-pay and kind of what the self-pay kind of comes with. And it is a different intake team that does the self-pay versus our waiver and AAA folks. So all that information is on our website. On the next one, I always share this. I'm not too sure if folks on here have a license and you need to do those CEU credit to kind of keep your license. Mom's Mills does offer 4 topics. These are free. Anyone can take them or sign up for them. There is a QR code that you can either sign up or learn more. So if you have someone that you work with in your agency, if they're nurses, if they're LPCs, if they need something to maintain their license, this is a great option. And like I say, it's free. And usually a couple of the nutritionists that we have will do a two topic Tuesday, which they'll cover 2 topics. You can kind of knock out 2 right away. So I always put that in there for folks. On the next slide is my contact information. So if you guys have questions, if you guys have an agency organization that you're like, hey, we do this, we do referrals, can you come and kind of do an in-service for our team or an educational session for our team? More than happy to do that. Or if you guys have questions, concerns, or if you guys have a health fair coming up or another community activity that you want us to come and support, set up a booth, kind of give more information about the medically tailored meals. Again, always feel free to reach out to me on that. And then on the last slide, more information. So I usually, and I've kind of hit up some of the case management agencies, kind of just doing a stop by really quick to drop off some case manager packets, just information for them, some important contact information for us. If you guys want packets for your teams, again, email me, I can ship them out to you. And then there's also flyers in there that you can actually give to your participants. If they're looking for a home delivered meal provider and kind of want to get some information on different ones, that's a good flyer for them to have. In the middle, if you guys want to learn more about Mom's Meals, if you click on this QR code, it will pull up every single YouTube video or channel that has ever been done on Mom's Meals. So you have people who do unboxings, which again, never understood that. And then there's testimonial from consumers, providers, and folks who work with us. And then on the other side is just a newsletter for the full scoop. So that's just articles, information about Mom's Meals, If you guys are needing to do like an educational campaign, we do those a lot in Arizona. We can actually sign up your folks. We have a provider and a consumer one, and it just gives information on chronic healthcare conditions, kind of new ideas that are coming out or new studies that are there. So another free resource for folks to access there. And that wraps up my presentation. I don't know if there's any questions, concerns.
I see two in the chat, and they may not be. Are you able to process SNAP dollars? So are you able to accept SNAP benefits as a form of payment?
We cannot.
Okay. Thank you for that information. So that was
Yep.
from Pat Cook. And thank you for the presentation. Tina, you can tell that everyone is really dedicated to the compassion and caring of providing meals to these populations. And just want to let you know that thank you for sharing all the information. It's very impressive the work that you all are doing. And you can tell that a lot of detail was taken into setting everything up. So I appreciate you presenting great information and great resource for us to have.
Awesome. And I dropped the link into the chat if folks
Oh,
want to
yes.
order a sample cooler. That's just the form that you utilize for that.
Thank you for that. And I think that that's a great idea. Yes, I will be sending out the slides, LaShawn, and the recording will also be uploaded to the TSAC webpage. I'm going to add these slides to, I send out a reminders email to the TCAs because I'm the transition administrator. So I like to kind of send them resources. I'm going to send this whole slide deck when I send it this month because it was just jam-packed full of great resources that I know that they can use. So I will send these out to all the TCAs as well, LaShawn, and it will be on our website. So I appreciate everyone coming. Can you please send the slides to Elsie? Yes, Rhiannon. I will make sure it gets to you guys as well. A lot of good information, so we definitely want to share and make sure we're collaborative with all of this information. So I appreciate you coming. I know we had one canceled and put one back, so I'm so glad you were able to present because this was really a lot of good information. And another thing I just wanted to pinpoint was I love this survey option, especially because a lot of the providers, they are the client facing providers. They're the ones who have that relationship. So to be able to say that they have tried the meals and sampled them and to be able to give a personal attestation to taking them is really, really cool. So I love that survey option for them to receive the meals to test them out. I think that's so cool.
Absolutely.
Yep. So thank you all. Lots of good information today. Are there any other questions? We had a program going in Denver. This will help quite a few. Yeah, Pat, this is really good information to have. And I know that the TCAs for sure. And I always say them, this is just who I primarily work with everyone. So I know for sure that they can use a lot of these resources and this information as well. So good stuff today. Do we have any more questions for Tina? All right. Thank you again for presenting, Tina. We really appreciate it.
Thank you for
Okay.
inviting me.
Yes, you're welcome. And the last thing is just a couple of referral reminders. So this transitions referral link was in the last TSAC, which was in December. So I thought it would be important to leave it in here as well. So this is the transitions referral link. And referrals can come from the community for individuals who want to transition from a nursing facility back into the community. They don't specifically have to always come from the traditional method that we use here internally. Friends, family members can refer members for transition. Of course, that may not necessarily mean they're a good candidate, but we will definitely work with them and attempt to proceed with that process with them. And this is just a screenshot of what the form looks like once you click on it. And that is it for our presentations. I just had the quick little reminder about the referral link, but today was really all about resources. I just saw another question pop up. So thank you, Carly. Yes, that's a link to the form for the referrals from the community. So thank you for dropping it there. It will be linked in the presentation as well. The next few meetings are listed here. We have March 5th, April 2nd, and I believe that last one says May 7th. Yep, May 7th. So those are our next meetings that are coming up. If you have any topics or anything you want us to discuss, please don't hesitate to reach out to me and let me know. We can work on adding that to the agenda. I know a few months ago we did like a survey just asking about what topics you all want to see, what you want to this time to be utilized for. And we had a really good results from that. We had a lot of you participate. We got a lot of good feedback. And we've really been trying to gear these meetings towards those preferences from that survey. So we hope we're doing a good job with with that, and you guys are really able to use a lot of this information and these resources that we're providing at these meetings. So that is it on the presentation front. Are there any questions? We now have time for open discussion. I believe we still have some time for open discussion. So if anyone has any questions, you can come off mute, you can raise your hand, you can drop it in the chat. I'll be quiet for a second just to see if anything comes through. Okay. Well, if we don't have any further questions, we can go ahead and wrap up today's presentation. You are very welcome, Pat. See if there are any more comments. Yeah, we can go ahead and wrap up. I'm going to stop recording and I'll hang out for a little bit just in case anyone does have any questions. But thank you to all the attendees, all the presenters. We appreciate everyone coming and sharing resources, being collaborative, giving us feedback on how you want to use this space. We definitely appreciate it. So thank you all for coming. Happy Thursday.